Okay, well, welcome everyone to our controlled substance and abuse policy training with Naomi Sutton of Work Life Hawaii, which is our employee assistance program provider. And we've been with Naomi for quite some time. And this training really isn't anything new. We've done this training in the past. We haven't done it for a while, but it is an important training, I think, for all of us as leaders and supervisors to go over. And this is a 2-hour training. There was handouts that was sent out yesterday. If you have not received the handouts or had problems with your email, do let me know and I can send it out again. But there's a lot of useful information in this training, and this information is contained in our policy that we already have, which is in our employee handbook. So without further ado, I'll go ahead and hand it over to Naomi. Naomi?
Thank you. Thank you, Renee. Good morning, everybody. I apologize for being here in Ewa Beach on Oahu. I think the last time we conducted this training was about 4 years ago, and I was in your Hilo office. So, thank you for tuning in and for tolerating the technology. I will try to get us through this as best as I can. We've been doing it for a while on Zoom. So hopefully we can get through all the information without a glitch. There we go. Okay, so our objectives are pretty straightforward. For those of you who are managers for CDL drivers, this training is mandatory. And so, if you went through it 4 years ago, that's great. There's a couple of updates that I want to make sure you guys are aware of that are pretty significant. We also, again, always want to give you more tools as managers and supervisors. Unfortunately, with the pandemic, there's been a spike in substance abuse and chemical dependency. And we are seeing, currently we're serving 97 employers statewide, and we are seeing spikes in all of the companies. So the likelihood that you as a manager might come across an employee with a substance abuse issue is unfortunately very likely in this day and age. So want to give you the tools in terms of how to identify possible misuse or dependence, to talk about your responsibility as a manager, and as well as the company's responsibility, to talk about how substance abuse impacts the workplace. And last time I talked about the cost, but it does impact companies' bottom dollar, as well as efficiency, morale, recruitment, all of those kinds of issues as well. And then I want to explain how, as your Employee Assistance Program or EAP, we support you in this particular area to make sure you know that substance abuse services are part of what we're offering to Suisan. If you have any questions at any time, please don't be shy and just feel free to unmute yourself. If you can remain muted for the duration of the training, it would be real important, especially because it's being recorded. But if you have a question, please feel free to interrupt and ask your question. It's a lot of information. And so if something doesn't make sense, just let me know. But as I mentioned, the prevalence in our country is just huge. And millions of people, almost 21 million people, or 1 in 13 people, they're estimating to have an addiction problem. So not just occasional or social use, but actual addiction or chemical dependency. During the pandemic, what we found is that not only has the problem increased, but the resources diminished. So early on in the pandemic, we were seeing a lot of providers go from closing up shop, closing up their practice, to pivoting to only Zoom. And we were having employees coming in with full-blown methamphetamine addiction, heroin addiction, alcohol addiction. And we had to advocate for those employees and say, you know what, we understand we're all in the pandemic, so we have that understanding, but Zoom is not going to be sufficient for this individual. So let's work with you on working out what would be more effective. And so things are getting better now as we get more control over the virus, but they are still not back to where they were pre-pandemic. So as a result, we've even been using out-of-state resources, which again was hard with the travel restrictions and all of that. So anyway, but the problem is substantial in our country. Sadly, and that's why the statistic, only about 11% of those who really needed treatment were actually be able to receive it. And this is back in 2015. It takes a few years to compile the data. So my guess is that this percentage is probably even lower since the pandemic, sadly. But the cost to companies, to employers, alcohol use being far, far more of a problem than illegal drugs. But that, you know, again, from several years ago, the cost was about 250 billion annually to employers for alcohol misuse, and for illegal drugs, almost 200 billion. And that's in terms of medical benefits, days sick, accidents, all those kinds of things, workers' comp. So huge costs. We know that employees abusing drugs and/or alcohol have higher healthcare costs, higher workers' comp claims, significantly more days lost, being absent or on leave than employees who are not abusing alcohol or substances. And bear in mind that employees who are impaired function at only about 2/3 of their normal capacity, which is really scary if you imagine someone driving a delivery truck and commuting between, say, Hilo and Kona. You know, super, super scary. They are 3 times more likely to be tardy and 2 times more likely to use sick leave. In Hawaii, and this is from DLS Labs, 8.2% of full-time workers are currently using illegal drugs. 65% of all work-related accidents are the direct result of substance abuse. That's huge. That's over half of the accidents that occur in workplaces. As many as 50% of all workers' comp claims involve substance abuse, a big issue that we're trying to assist our employers in screening for is for opioid addiction amongst those who are on workers' comp. Typically, employees get injured and they get treated either with or without surgery and get placed on prescription pain medication or opioids, and then become addicted if the issue doesn't resolve adequately. So we've been looking at that. And there is a definite correlation between opioid addiction and workers' comp. 80% of drug abusers eventually end up stealing from the workplace to support their addiction. As I mentioned, COVID-19 has just made it so much more difficult for all of us, actually, but particularly for those who had either a substance misuse issue, kind of like on the borderline of misuse and addiction, people who have been struggling with addiction, and people who actually went through treatment have relapsed. So we have seen more of this since the pandemic began. So almost 2 years now, it's been extremely, extremely challenging. And this is data from the CDC that came out during the summer. And we know that 40% of in our country are struggling with more mental health and substance abuse issues since the pandemic. And we at the EAP definitely can attest to that. It's been nonstop, a lot of employees in crisis, and a lot of employees, what I've noticed as a substance abuse professional, I've noticed that employees are coming in with higher levels of addiction. In other words, employees who are willing to enter treatment, but really struggle. So I currently have an employee on Oahu who is struggling with methamphetamine and heroin addiction, and is now in an intensive outpatient program. Just got a call from the treatment provider saying she has not been able to stay clean for the past 3 weeks, and they are recommending a higher level of care, which means residential treatment. So we're seeing a lot more of these kinds of cases. And again, super hard to figure out who has an addiction problem and who doesn't, who is a drug user, who isn't. We've seen it go across the board. We've had children, Keiki, with addiction issues, and their parents who are our eligible employees, bring them in for an assessment. And we've had doctors, nurses, attorneys come in for struggling with addiction types issues. So it does not discriminate culturally, socioeconomically. There are some industries that have a higher incidence that we've been working with in terms of prevention. So sadly, it's been across the board. Renee had sent, one of the handouts she sent you was the quiz, the drug and alcohol quiz. So at this point, if you can pull that up, hopefully you made copies and of the drug and alcohol quiz, which I have. And as I go through the presentation, I'll be providing you with the answers. So if you haven't done the quiz yet, you can take a minute or two to do it now. And like I said, keep it handy because I will cover all of the answers by the time we're finished.
Hello.
Hello?
I don't think I have the quiz.
Oh,
What
shucks. Okay,
did you have it?
let me,
I
Renee,
print
you remember seeing it?
Yeah, it was part of
the printout.
the documents that we sent over staff yesterday, but I can try and resend it to you.
Yeah.
Yeah,
Because I thought I printed up everything.
okay.
Okay, if you don't have it, Renee, let me know.
Oh, no, I have it, but
Okay,
let me see. I don't,
okay.
hold on.
Anybody else didn't get it?
I don't think I get them either.
It's called AMD quiz. I don't know.
Yeah, what does it look like? What does it look like?
Let me see if I can pull it up.
Let me see.
Yeah.
Okay, go ahead and check your email and see if you guys have it now. It's A&D quiz.
Okay.
Yeah, I never have this
Oh,
one.
okay.
Okay, I just got the email.
Take a look at that. Sorry, I guess that was missing off of my list.
Okay.
They should be getting it now.
Yeah.
Are you guys getting it?
I'll print.
I got 'em.
It's true and false. So, oops. Okay, I'm gonna go forward. And then again, please don't worry if you just got the quiz, just keep it handy and then we'll go over the answers before we're through today. So specifically, I want to talk about the DOT drug and alcohol regulations. This is where your commercial driver's licensed employees fall. And there are 6 administrations under DOT, and the CDL employees fall under the one with the big red truck in the upper left corner, or the Federal Motor Carrier Safety Administration, or FMCSA. So what that means is that the FMCSA can come in at any time and audit those employees' files to make sure that Suisan is following the DOT guidelines for drug and alcohol. So the DOT identifies safety sensitive, you'll hear that term a lot, safety sensitive employees. And all that means is employees who fall under the jurisdiction of the 6 administrations that I just showed you. And under FMCSA is any employee who's required to have a CDL to perform their current duties. So there may be employees who have a CDL, but they don't really, it's not really required for the particular job that they have. Maybe they used to drive, but they no longer do. So the FMCSA is interested only in those that need a CDL to perform their current jobs. And remember that according to the DOT, the primary goal of their drug and alcohol program is to protect the safety of the traveling public. So they always recommend erring on the side of safety. And so for us as substance abuse professionals, that's where our recommendations come from, is what would be safer. If someone is borderline substance misuse, substance dependence, this guides, our recommendations for that particular employee. So again, bearing that in mind, types of testing that is required for DOT safety sensitive employees pretty much follow your Suisan controlled substances and alcohol policy, which is wonderful. So pre-employment testing, random testing, post-accident, reasonable suspicion, and we're going to talk more about reasonable suspicion later, return to duty and follow-up testing. The last 2 types of testing are asterisked because for DOT CDL employees, they must be conducted under direct observation in the laboratory. So return to duty is conducted after an employee goes through treatment or education. They have to produce a negative result on their return to duty test, and that is conducted under direct observation, as well as the follow-up testing that is recommended by the substance abuse professional for once the employee resumes duty. Those must also be conducted under direct observation in the lab. Questions about that? Okay. Every year, the DOT comes up with required random testing rates. So these were the rates for 2021. And again, your concern is going to be here under the Federal Motor Carrier Safety Administration. So 50% of your CDL employees must be randomly drug tested and 10% must be randomly tested for alcohol. Refusal to test. So the DOT identifies 9 conditions, and this is one of your handouts as well, that qualify as a refusal according to the DOT. Suisan also addresses it in your policy for controlled substances and alcohol. So any employee who has been considered a refusal to test has the same consequences as having a positive test result. So yeah, the DOT, take a look when you have time to go over the 9 conditions, because some of them are not so obvious. It's not always, no, Renee, I'm not gonna go take the test this morning. It might be failing to go to the lab and follow the lab tech's instructions, including emptying out the contents of all your pockets. For those of you who have been random tested, you know the drill. And that's one of them is please empty out your pockets and place it wherever they have you place it. But we've had employees who were deemed refusal to test when they took everything out. We had an employee who took out his keys, big bunch of keys from his pocket, and slammed it on the desk at the lab. And he was upset, obviously, about being tested. And the lab deemed him a refusal to test because of the lack of cooperation. So please make sure that all employees recognize that these are the conditions that can be considered refusal to test. Questions? Okay, so wanted to go over a few of the key players in this process. And one is the medical review officer. And this is the person that receives the drug test results and interprets them, and then talks to your employee. So employees who have a positive test result gets contacted by the MRO. And the MRO informs the employee and explains that there was a positive test result for such and such substance. And it's at that time that the employee has the opportunity to explain why that substance was in their system. For example, a prescription painkiller. Oh, I had a root canal. MRO will ask, what was the date of the root canal? Who was the dentist? Where did you get your prescription filled? So the MRO will then have to verify all this information. And if it's verified, then it becomes a negative result. If it cannot be verified, then the MRO will proceed to call Suisan and report the positive test result. Okay, any questions about that? The employee has 72 hours, once notified by the MRO, to request that the split sample, for those of you who've gone through random testing, the lab does a split sample. And so at that point, an employee who tests positive can request that the other split be tested as well, just to ensure that there's no error on the part of the lab. Questions? Okay, so the designated employer representative is the person at Suisan that receives the positive test results from the MRO, refers the employees who test positive to a substance abuse professional, receives the substance abuse professional's recommendations, as well as documentation of either compliance or non-compliance, and implements the follow-up testing schedule. So that person is really, really important at Suisan. So who is that person? Do you guys know who that person is? Renee?
That would be me.
Okay. So it would be Renee that gets, she is the person, the keeper of all that information. And it's super important that it goes to one person, because drug and alcohol information is highly protected under HIPAA. So people's drug tests, the letters from the SAP cannot be distributed to anybody else except the DER. So just so everybody knows, the substance abuse professional will get the referral from Suisan and conduct the initial evaluation. So the test results, all of that will be sent over by Suisan to the SAP, and the SAP is going to recommend either education or treatment. Doesn't matter if they took one hit on a joint, but according to DOT, the recommendation has to be either for education and or treatment. It would never, ever be nothing. So if an employee ever comes back and tells you, hey, boss, I went for my evaluation and they said I'm good to go, please talk to Renee right away because something is not right. So that is a DOT requirement. The SAP monitors the employee's progress in education or treatment, monitors compliance or non-compliance. So the SAP monitors their attendance and participation in the education or treatment program, and then determines the follow-up testing schedule. For DOT employees, it can go as long as 5 years. So, just again, something to be aware of. And the SAP, I don't know, Renee would be the one providing information to the employee on how to get a hold of the SAP and schedule their initial evaluation. So there's an initial evaluation and a follow-up evaluation when the provider lets the SAP know that the employee has completed. Okay. So with COVID, even the DOT had to make adjustments. And I just got information hot off the presses that the DOT is going to allow telehealth evaluations till, I believe it's the middle of 2022. So before, the requirement used to be face-to-face. DOT was very adamant that it had to be a face-to-face evaluation with the SAP and the employee, but they are requiring, they're allowing for telehealth with the requirement of the technology. So the technology has to be like this, what we're doing now, where there's two-way live communication with both visual and audio. And you know what? I mean, everybody thinks that in this day and age, no problem, right? But that's not the case. We have had employees, for example, who live in remote areas where their internet connectivity is not good. And so it's become an issue. We also have employees who are not tech savvy and are, as they say, old school. So we've provided tech support on our end to teach employees how to access their camera, access audio, if we're doing telehealth. But in some cases, because either of the lack of technology, lack of internet, we have been doing face-to-face as well. So we have been adhering to all the CDC policies and procedures, the county and state restrictions, using PPE and social distancing. We've been conducting face-to-face evaluations. So just to let you all know, my personal preference throughout COVID has been to do face-to-face evaluations, because my opinion, again, my opinion is that you miss a lot potentially. If someone, for example, just took a drink and has the smell of alcohol, I wouldn't be able to pick that up technologically. So depending on which SAP you are using, they may or may not be doing telehealth or face-to-face at this point. Any questions, comments?
So is Work Life Hawaii our SAP?
Yes. So we are, Suisan's contract does include substance abuse services. Renee, I don't know if you use other SAPs as well outside of Work Life Hawaii.
No,
That would be, okay, that would be the employer's prerogative. But, you know, we do, it is covered under your current contract with Work Life Hawaii. So there is a referral form that we'll go over as well. So what's come up more and more is employees are self-disclosing to their managers. They're not testing positive. They're actually going to their managers and supervisors and self-disclosing a problem. Even in that case, you can please consult with Renee right away. And then you can work on a referral to Work Life Hawaii.
Thank
Good
you.
question. Good question, Wesley. Other questions? Okay, so another requirement that came up, DOT is requiring, they created a clearinghouse, which is a national registry of any employee who has a CDL and has a DOT drug and or alcohol violation. So now the requirement is that all employers with CDL employees must register on the clearinghouse. So that's the website. So Renee, probably it would be you to go in and register. When an employee tests positive, the employee, him or herself, must also go into the clearinghouse and register. Okay, so this became effective January 6th of 2020. What you want to do is to call Work Life Hawaii first, and then let us give you the name of the SAP that will be working with your employee, because when your employee goes into the clearinghouse, they're going to have to select their SAP. And there are hundreds, if not thousands. So if you call Work Life Hawaii ahead of time and say, hey, we're gonna send someone over from Suisan, he or she has a CDL, which SAP should they select? And we'll provide you the first and last name. And so the employee will have to go in, select the SAP, and what that's going to do is generate an email to us. And so the SAP will get an automatic invitation to conduct the initial evaluation. So it'll say Joe Smith is requesting an initial evaluation. And so then that provides me with access to the information in the clearinghouse. So just to be aware, many employers are actually sitting down with the employee to make sure, help them maneuver the clearinghouse requirements. This is nationwide. And so once the employee is in the clearinghouse, they need to complete the whole process. So when I meet with them, for example, if I was the SAP and I conduct their second follow-up evaluation, I then go into the clearinghouse and enter that date. And that will tell FMCSA that your employee completed the process and fulfilled all the requirements. There's information that the employer has to enter. There's information that also the MRO has to enter. And all of that is contingent upon the next step. So we've had employees calling us and saying, hey, I'm off work. I want to schedule my initial eval. And we're saying, sorry, we haven't received an invitation yet. And so then the employer has then gone back and tracked down, hey, our MRO hasn't entered his or her information yet. And so it's holding up the process. So every person has a piece in this process. So, just to understand that it's now regulated and kind of watched by the FMCSA. Recent information I received is that there are a lot of employees who are registered in the clearinghouse that never complete the process. And so DOT is really, really concerned about that. And without completing the process, that employee cannot drive anymore anywhere in the US. So it is a national registry that follows the employee. The employee cannot be returned to safety sensitive duty until they complete the entire process. So I know it causes hardship for a lot of employers when things kind of drag out. So anyway, number 2 on your quiz, that brings me to one of the quiz questions. Suisan employees must complete substance abuse treatment within 3 months. True or false? Anybody? You have a 50-50 chance.
I think it's true.
That is absolutely true. That is true. So 3 months
Yeah.
from the time of entry. And so, again, yeah, employees need to know that. So that is a true item. Any questions? Okay, so as I mentioned, these are the individuals that are required by DOT, and there are penalties if we don't comply, right? Because it's federal guidelines. So these are the individuals who must use the clearinghouse. The driver themselves, the employer, so Suisan, third-party administrators consortia doesn't apply here, but the MROs, substance abuse professionals, and licensing agencies. The test 4, so we talked about the different types of tests, and they test for alcohol, marijuana, cocaine, amphetamine, methamphetamine, opioid, and PCP. Questions about that? One of your handouts gives you a chart of different substances that are not even listed here. So, just because somebody's test comes back negative, bear in mind that these are the substances that they were tested for. And it's very possible that they could be under the influence of something else. And that's why I gave you the chart. So please take a look at the chart when you've got a moment. It lists other substances as well. Starting with alcohol, again, we know that it's a far bigger problem than illegal drugs, nationwide, probably worldwide. And the reason is that it is legally accessible as long as you have age. As long as you're 21, you can go to Long's, Costco, and buy alcohol. So, it's readily accessible and available. When you look at this slide, look at the alcohol content. And that's what we're concerned about when we do our assessments. We ask the employee, when you drink, typically, what do you like to drink? And their answer is, for us, it's clinically significant. If they say, you know, that they have 3 cocktails a day, very different than in terms of, you know, I have 3 beers a day. So just food for a thought. Questions about alcohol? Okay. So the prohibited alcohol use according to the DOT is cannot have an alcohol concentration of 0.04 or greater while on duty, cannot, of course, use alcohol while on duty, cannot use alcohol 4 hours prior to duty or 8 hours after an accident or until tested. Okay. What is the legal limit in Hawaii? Anybody? It's 0.08.
0.8.
Exactly, exactly. So there is a difference between DOT and state standards. The signs and symptoms, most of us know if we're around someone who's had alcohol, we know the signs and symptoms, the obvious odor. Bear in mind that there are other things that can also cause the odor, things like mouthwash. And because for DOT testing, it's a breathalyzer, and the employees blow into the device, it is possible for someone who just used Listerine, and then I don't know why they would use mouthwash and then walk into the lab, but it's possible to test positive based on that mouth alcohol. The unsteady gait or unsteady walking is common. Slurred speech. Memory blackouts happen when they are fully conscious. Just have gaps in memory. How did I get home? How did I drive home? I don't remember driving home. I don't remember changing clothes. Those are called memory blackouts, and they can happen at any time. People do not have to be alcohol dependent to experience memory blackouts, and it shows you that alcohol has a direct impact on the brain. Lack of inhibition, shy people become very social, life of the party types of people, loss of coordination. You as managers and supervisors are very likely to see some of these effects: impaired reaction time and motor coordination issues, reduced concentration, employees not being able to focus. You know, you're giving instructions and they don't seem to be able to focus on what you're saying. People who take unnecessary risks. Increased angry outbursts is something that we see commonly as well. Euphoric high, meaning, oh, you know, they're feeling good, and all of a sudden go into inactivity. You find them in the corner sleeping or in their vehicle sleeping. Visual distortion or blurred vision. Questions about alcohol. So on your quiz, number 15, drinking coffee, eating bread, or taking a cold shower can help one sober up faster. That is false.
False. Yeah.
Yes, because again, going back, to this, we're looking at the alcohol level in the person's system. So yeah, none of these things are gonna reduce that. So any questions? Please be cautious about employees who disclose to you that they've reported to work and they're hungover. That happens pretty commonly. And then you have to make a decision as to, again, erring on the side of safety. Do you allow that employee who says, boss, I'm okay though, I can work? Do you, as manager, allow that to happen? And what do you do? Do you say okay and take your chances? And then if you say, no, I cannot have you work, then what do you do with them? Do you let them drive home? We had an experience where an employee reported to work under the influence. Supervisor sent him home, and the individual was driving a company vehicle. So, it can get very, very complicated and risky. So again, think about, I would get together with Renee and make her aware. Once you're aware, then there's responsibility and possibly liability. So once they tell you, hopefully they stay home. But if they come to work and they tell you, give you that information, then you as a manager, as an employer, have to make some decisions as to what happens. Questions? Okay. Marijuana, again, really highly used in our state and our nation. Different forms. It comes in different forms. I think Michael Phelps was probably the one that was more famous, got caught using marijuana shortly after he won all the Olympic gold medals. If you saw Michael in the past Olympics, he's been a real strong advocate for mental health as well as substance abuse treatment. And so, something to kind of bear in mind. The edibles are in our state. I have evaluated several employees whose form of marijuana use were the edible type. And so we've had employees who go on vacation to states like Colorado that allow legalized recreational and medical marijuana use. And then they come back, go to work, and then they get random tested. That would still be a positive test. Yeah. So these are the different forms of edibles. Know that they are sold and people are partaking. So the other big issue that has come up for us as substance abuse professionals are the CBD products. I had an employee on Oahu who was using daily CBD for back pain and tested positive. Safety sensitive employee. He was in treatment for about 3 months. Would not have been able to pass his return to duty test because his THC level was way too high for 3 months. And according to him, he had stopped using the CBD product. And he said, he brought in, this is what I bought. It says that there's no THC in it. Well, CBD is not regulated. So, what's advertised and what employees, people are actually getting may be two different things. And so he said, it was advertised as not having THC, and his THC level was so high, we could not get it down low enough for him to be able to pass a return to duty test for 3 months. So please, again, employees need to know that it is possible to test positive for marijuana using CBD. Questions? Okay, so the legislation is ever changing when it comes to marijuana. There are 6 states where only 6 states, I should say, out of 50, where marijuana remains fully illegal. So no medical marijuana use, no recreational marijuana use. CBD oil is the only form approved for medical use in 7 states, and they're listed there. However, it remains illegal under federal law. So DOT says no. And CDL drivers cannot test positive. It doesn't matter, even though medical marijuana is legal in Hawaii. If you're a CDL driver, you cannot use it. Questions, comments about that? Okay. No? Okay. Signs and symptoms, again, most of us know, minus nowadays, it might be minus the odor that we all know when someone's smoking weed, we know that distinct smell. Keep in mind now that there are edibles and there are topicals that could be used that would have no odor. So again, what you're looking at are the signs and symptoms and the possible effects. So, you know, you cannot now say, oh, can't smell anything. Maybe it's not. It could very well be. But these are the signs and symptoms typically associated with marijuana. These, again, are things that you might see as a manager or supervisor. So impaired slow reaction time, inability to concentrate and focus. Impaired tracking means the ability of the eyes to track something. So marijuana impairs that ability of the eyes to kind of shift and focus. If you're a driver, I would imagine that that's super dangerous. Distorted time and distance sense, lengthened glare recovery, again, major impact on the eyes that people may not realize. Distorted depth perception. So it may be someone that you think, wow, this person sure is clumsy. They're tripping all the time. Well, it could be distorted depth perception that they're experiencing. So with the legalization of marijuana in so many states, we have data now. And now what we're finding is that people who use marijuana, whether it's medically or recreationally, tend to experience more balance and coordination issues, have a really higher accident rate, 85% higher injury rate, talked about the clumsy or accident-prone individual. They find that individuals have difficulty learning new tasks and performing complex ones, again, because of the memory and focus issues, loss of energy and interest in the job. Questions about marijuana or CBD or any of that? Okay. Moving on to the stimulants, there's quite a bit of cocaine use in our state that we have been seeing. And cocaine is a stimulant, different forms of use, from snorting to injectables to pills. It's not always white. It can be dyed, can be flavored, all kinds of forms, yeah. So as of 2010, the DOT lowered the cutoff levels for cocaine, cut it in half, feeling that a less amount of cocaine would actually cause impairment. And again, they're looking at the safety of workplaces. Signs and symptoms, you're going to see somebody who initially is going to be very energetic and possibly nervous. If they're snorting, there's going to be nose issues. So runny nose. Oh, boss, I have terrible allergies. Can't shake this cold. Those kinds of things. Short attention span. Cannot focus. Changing topics all the time, continuously. Restlessness, nervousness. Cannot sleep at night. And loss of appetite. So the stimulants trick the brain to thinking that no need sleep and no need food. So typically, but not always, people lose weight and they start to have sleep deprivation related types of issues. So lapses in attention, concentration, aggression sometimes, overreaction, overcompensation in their behavior, impaired coordination, periods of loss of consciousness. Sometimes this is mistakenly taken as a medical issue. So on Oahu, we've had recently 2 employees who had seizures at work. And so they were sent to their physicians, no history of seizures or epilepsy. And so the employer called the EAP and said, you know, what do you think? The doctor cleared them to go back to work, but we're a little bit concerned. And so what we recommended was at that point an EAP referral. And sure enough, both employees came in and acknowledged stimulant use, one for cocaine and the other one for meth. So, you know, something to think about, something to consider. Again, you know, you would err on the side of safety. Impaired judgment, we see all the time. False sense of alertness and security. I mentioned convulsion seizures, but even cardiac arrest and stroke. We're seeing more and more young people. When we see cardiac conditions amongst young people, sometimes when we do evaluations, we ask about any drug use. Distorted vision, glare recovery, again, impacting the eyes, hallucinations, people imagining things that they experience through their senses. It can even be something, I smell something weird that none of your other employees seem to be able to smell. We had an employee that said, there's bugs on my desk. And so, you know, the employer took precautions, had the place fumigated, and she went back to work and she said, there's still bugs because she's scratching. Well, those can be tactile hallucinations, which could be drug related. So just again, food for thought. Psychosis, anxiety, people panicking for no apparent reason, and depression. So it stimulates people for a little bit, and then it actually has the opposite effect of really making them super depressed. So what happens is they'll use again to bring them back up, and then they'll come down again. And that's why it becomes an addiction and vicious cycle. Questions? Okay, so another stimulant still around, despite all the meth busts and raids, methamphetamine is still prevalent in our state. And it comes in different forms. It's not always smoked with a glass pipe. But this is ecstasy. And Suisan does test for ecstasy, so does the DOT. Real popular as used to be, we used to call it a club drug, where people would take it when they go clubbing. And this is number 1 on your quiz, and it's called Strawberry Quick. And it is actually true flavored methamphetamine. So it's colored and it's flavored, and it's also infused with CO2. So it gives the sensation of pop rocks when you put it on your tongue. And so you can imagine who the target audience is for this particular drug. And it's cakey, which is really sad as a parent. That just, it just infuriates me. So please share information with your keiki, whether your parents, grandparents, aunties, uncles, because it is around, and kids end up going to the ER for overdose. So please, please educate, not only for your role as managers, but also please feel free to share any of this information with your families. Questions about that?
One question, I don't know if it
Yeah.
pertains to, but with this vaping that's going on,
Yeah,
can they
yeah.
put something in there and
Oh, yeah.
Okay.
It can even, we've had issues on Oahu with marijuana vaping.
Wow.
I haven't come across meth, but it definitely, I would think, if there's a will, people find a way, and it's really, really scary. There's a lot of promotion now about the dangers of vaping. So very scary stuff. It goes straight into the lungs in real high concentration.
Right.
So definitely, if you as managers or supervisors see erratic or unusual behavior, please intervene. If they bring it to work, hate to tell you, but it's now become your kuleana. You have to do something, because we've had incidents where people try to give employees the benefit of the doubt, turn the other way. They might be longtime employees. And then it gets worse. It gets worse. And then it blows up. We had an incident on another island where it blew up. The employee was coming to work repeatedly drunk and intoxicated and sent home. And finally, the manager said, hey, we got to do something, let's bring him to the ER, because that's how drunk he was. And they brought him to a lab. And so the lab said, you know what, you need to bring this person to the ER. And then at that point, the managers and supervisors realized, okay, now we're all in big trouble.
Yeah.
And so, it blew up, and we ended up doing this training immediately. So anyway, but good question, Safri. Good question. Robert Downey Jr., Iron Man, he had a huge methamphetamine problem. And like I said, it doesn't discriminate. He relapsed so many times in and out of treatment. And currently, again, another advocate for addiction treatment. He is clean and sober, super talented actor, but somebody that really battled methamphetamine. So in 2010, DOT started testing specifically for ecstasy use. Like cocaine, they lowered the level for a positive test. Again, the concern being that it takes less meth or amphetamine to impair their work performance. And then they took out in 2018, they took out one form of meth because they felt that it wasn't as widely used as before. Signs and symptoms, super similar to cocaine. It is a stimulant. You're going to see, sometimes, not always. I've evaluated meth users that were overweight. So, you know, it's not, we cannot keep that stereotype in mind that they're all going to have acne and be bone thin, because that's not always the case. But it does impact, again, sleep. It has super big impact on the heart, causing blood pressure issues, mood issues, anxiety, irritability. Again, very similar, the mental, physical fatigue because they're not sleeping. And so as long as the substance is in their system, they're going, not eating, not sleeping, and their motor coordination is going to be impaired. Lots of accidents, lots of errors. So aside from people who are CDL drivers, think about the impact of an employee who is doing your accounting at a desk. Still, that's a huge issue if they're making errors and mistakes. So, you know, not only focusing on drivers, but other employees as well. And I noticed that your policy covers everybody, not only the CDL people, so which is wonderful. Any questions about the stimulants? Okay. The opioids or the prescription painkillers, heroin is also included in this class. So comes from the poppy plant here, very innocent looking. And then typically we see it in medication form, pills, capsules, heroin is included, and cheese is on your quiz. So number 10, cheese is a mixture of heroin and Tylenol PM or Coricidin or some over-the-counter cold remedy. And that is absolutely true. So in the 80s, kids, middle school, high school kids were getting a hold of heroin, which is cheaply sold is what I'm told. I've never bought heroin, so I don't know, but I've heard that it's very cheap to acquire heroin and then to get something out of the medicine cabinet and then grind it up. And so it looks like Parmesan cheese that goes on your spaghetti. And kids were getting high and ODing on that. So that's what cheese is. Michael Jackson, upon his autopsy, we learned that he had long time use of propofol, which was an injectable, and that's why the legal action that happened after his death was that his personal physician was accused of giving it to him IV, which is super strong and caused addiction. So in 2010, heroin was added to the DOT panel of testing. And in 2018, DOT added the prescription painkillers. So I used to have employees that would come in and say, you know what, I tested positive for THC, but I took Vicodin that day and then I didn't test positive. Well, since 2018, guess what? That employee, same employee would have tested positive for both opioid as well as THC. So this is not all the brand names that are included. There's hundreds more. Any questions about this? So I am looking at your quiz. Number 4, prescription painkillers may be used while working as long as the employee has a doctor's note. What do you think Suisan says about that?
I said no.
Yes, it is definitely no. And so these are the signs and symptoms that I want you all to look for. It would be the total opposite of a stimulant. You're going to see a drowsy employee may tell you that they didn't get much sleep last night. They may nod off. If you've ever talked to someone under the influence, you can actually see their eyes roll up to the top and they start nodding off. No reaction to painful stimuli, which is exactly what opioids are supposed to do, is to control pain. Decreased appetite, not to be too much information, TMI, but some people have constant constipation with chronic use of opioids. Daydreaming, coma or death from overdose. I was reading recently that there's been a spike in opioid overdose. So something we should all be aware of. Intoxicated behavior, may have glassy eyes, just like alcohol, but might not have the smell, yeah. False sense of security, difficulty focusing, visual distortion. Again, a lot of these substances impact the eyes. So something to be aware of, euphoric high followed by stupor, inactivity, sleeping on the job. Always talk to an employee who seems to be always sleeping on the job to find out, because one, that is a job performance issue. You can always refer them to us for an evaluation. And you don't have to poke around the source of why they're sleeping on the job. We do. So we can help you figure out, are they having family issues or are they having drug or alcohol issues? So just food for thought. Questions about the opioids?
Naomi, I had a question.
Yeah, Renee, go ahead.
What's an example of a false sense of security on that symptom list that you had?
Someone goes into your warehouse, climbs up a ladder when they're intoxicated or they're impaired. So they, and you know, the manager may say, hey, wait a minute now, you know, and they take a real big load up a ladder. And so thinking that they can do it, even though in reality, they may be under the influence. And even sometimes managers say, no, 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 you know, we normally don't carry that kind of a load and bring it up. No, I got this. You know, what do you mean? I've been working here how long? I know. And so that's typically what you guys would see.
Okay.
Is this, yeah.
Yeah.
Good question, Renee. Other questions, you guys? Okay. PCP, phencyclidine. It's not only on the mainland, it is here in our state. Super, super scary. It is used to be used legitimately as a horse tranquilizer. They don't even use it for horses now. So it's super, super scary. If anybody reported to work or you had a customer high on PCP, best you call Hawaii police, because these are going to be very scary individuals. It comes in pill form. More commonly, it is powder that's laced in a regular cigarette or a marijuana joint. And people don't always know that their joint or their cigarette contains PCP. But then you start to see all these very bizarre signs and symptoms. So again, stimulated or slowed body functions, changes in the user's perception, irrational speech and behavior. Boss, I can go up there. Nah, no need ladder. I can just fly. I can fly up there and bring that down for you. I mean, you're gonna notice. You're gonna notice, hey, okay, wait a minute. Very, very bizarre behavior. Sometimes we see paranoia, fearfulness, anxiety, panic, violence. And that's why you don't want to subdue someone yourself or make physical contact with someone high on PCP. Amnesia, coma at higher doses. You're going to see someone who thinks that they can fly, that they're God, that they're an angel. Very, very bizarre, distorted thinking. Again, the invulnerability and power. No, I'll be fine. I can do this. On the mainland, there were episodes of people jumping off buildings, high on PCP, things like that. Hallucinations, visual distortion, loss of time perception, impaired coordination, dulled senses, convulsions, coma, and of course, death. Questions about PCP? Okay. Impact is huge. These are some of the job performance issues that are common amongst folks that have a drug and or alcohol issue. Now, understand that someone can not have a substance abuse issue and still have these issues that are related to something else, like family problems or mental health issues like depression. So again, these are some of the things, behaviors that you might see as a boss, as a supervisor, as a manager. Look for absenteeism, should be a red flag for you. Start documenting when you notice that there's a pattern of absenteeism. People that may show up for work, but are not in their work area, or you cannot contact them. They're out of contact with you. You know they punched in, but you have a hard time finding them. That's an issue. That's an issue. Frequent illnesses, again, you know, oh, I have really bad allergies. Oh, I have this cold that I haven't been able to shake. You know, pay attention to that and document. Might be allergies, might be sinusitis, but, you know, could also be something else. Accidents, big red flag. And notice not only on the job, but off the job accidents. Somebody breaks their leg at home on the weekend or on vacation is going to impact their ability to work anyway. But pay attention if somebody seems especially accident prone. What is that about? Also pay attention when there's damage to your equipment. I've told this story before of one of our companies, one of our airline companies that we serve. They noticed that whenever this particular employee came to work, this real expensive machine always broke down. And then it had to be sent to the shop and was unavailable for weeks. And so, you know, the manager started noticing, hey, how come only when so-and-so comes to work or uses that machine, it breaks down? And the more they paid attention to it, people started saying, yeah, that's true. And so finally, the manager sat down and talked with her and found out that there were more issues than at first glance, ended up referring her to the EAP, and we found drug and alcohol issues. So pay attention. Communication, big time communication issues, people being vague, unclear, might be avoiding you in management, not making eye contact, not being responsive to communication. Arguments, another big red flag. Concentration, all of the substances we've talked about so far impact concentration. So what you want to look for is someone who takes longer to do a job than anybody else, forgetful of deadlines and procedures, even though they've been with you for a really long time and should know by now, difficulty handling complicated tasks, hand tremors. Always ask about hand tremors. Don't ignore them. It could be a medical thing as well, to say, hey, and I ask, I'm comfortable when employees come in and they're filling out of our forms and their hands are shaking. I ask, are you nervous? I call attention to that and ask about that. Sometimes we've noticed with employees who, for example, have an alcohol problem, when they come and see us, they're not going to drink. Well, what happens if they're drinking all the time and they abruptly stop drinking? They're going to go through withdrawals. And one of the signs are hand tremors. So efficiency, mistakes, errors, bad decisions due to impaired judgment, wasting materials is a big red flag. Relies heavily on other employees for help. And eventually you're going to see morale issues pop up. They may not tell you why, but they may not like working with certain people. And so, pay attention to that. And as well as a lot of improbable excuses for poor performance. You just start hearing a lot of excuses that after a while, you start to shake your head and go, really? That doesn't sound real. Work patterns, productivity goes up and down. Sometimes they're excellent. Sometimes you scratch your head wondering, what the heck did they do today? Because none of this is done, or it has to be redone. Initiative. People typically don't take initiative when they're struggling with substance issues. And they have a real hard time with change. So if you say, okay, so we're gonna change delivery this morning, we're gonna do this instead of that. And everybody goes, oh, okay. And you have one employee that goes, what the heck? And just has this kind of overreaction to change that everybody else seems to be able to adjust to and accept. Very, very difficult to make changes when you're struggling with drug and alcohol issues. You're trying hard enough to concentrate on what you know, and then your boss or your manager goes ahead and changes procedures. So pay attention to things like that. People needing more supervision or extra help. And you're gonna see lots of interpersonal issues. People overreacting to criticism or your feedback, which as a manager, supervisor, administrator, you should be able to give feedback to employees to help them improve. But we see overreaction, people taking it as criticism instead of feedback, being overly critical of other people at the same time, complaining, complaints from coworkers saying, I don't like being around this person. I got to walk on eggshells. This person's snapping all the time, but complaints like that. Wide mood swings. Some days happy-go-lucky, other days doesn't speak at all to anybody. Makes unreliable or untrue statements, in other words, lies. Avoids others, especially eye contact. Remember, the substances we talked about impact the eyes and vision. So you're going to see changes in pupils, dilation or constriction. And so a lot of times you're going to see the dark glasses or just not making eye contact with you. Talkativeness with rapid subject changes. Questions about that, you guys? Again, those the impacts, these signs could be an indicator of other problems. It isn't always drugs and alcohol, but might be worth chatting with Renee about, consulting with Renee about, or even calling us at the EAP for consultation and say, hey, you know, I noticed this about one of my workers. Might be nothing, but what do you think? You can feel free to do that. It's all confidential. Your role is really to identify performance issues as soon as a pattern start to emerge. So attendance, you know, they were 10 minutes late this morning. Maybe no big deal. It's been raining over there. But if they keep this up for a week, a month, then that's a definite pattern, and you have to start documenting, consulting with Renee in HR, putting it on your radar. Talk with Renee about the possibility of referring to the EAP, either because you don't know yet whether it's drugs or alcohol. You can always do an EAP referral, and then to start thinking about a plan for the employee. You know, don't let it go. Don't turn the other way. 1 second, I dropped my quiz. Okay, so going back to your quiz, number 13, substance dependence or addiction is a chronic, progressive, relapsing, and ultimately fatal condition if left untreated. And that is true. So we do know, I know sometimes we hope and pray that things will get better. But if we're talking about substance misuse, addiction, we know research, there's plenty of research now available that shows that it is progressive. Personally, in my family, there is substance. There is that gene in our family, and there has been family members in my family, at least, who have succumbed as a result of substance abuse. So sadly, you know, it does happen. Reasonable suspicion testing, very important for you all to know, because this applies to any employee who appears to have reported into work impaired. They are just behaving or appearance that there's a possibility that there could be drug or alcohol use. So I have sent you all the reasonable suspicion checklist that you can use. Please have that available, because these things happen without warning, and you want to pull the checklist, call Renee right away, let her know that, hey, Renee, we may have a reasonable suspicion situation. You want to, if at all possible, grab another person who is attending this training today and say, grab your checklist, we need to meet with an employee. So you want to observe the employee, and you want to check off the items that you see present at that particular time. You have to observe it yourself. You cannot say, hey, Renee, go see if Joe's okay, and here, check off what you know. It has to be you directly observing the individual and then checking items off, and then deciding whether or not it justifies a reasonable suspicion test. Make sure that you meet with the employee privately. In some of your settings, it might be really challenging because there's stores and warehouses, but make sure, consult with HR and find out where the meeting can occur so that there's privacy. Have to arrange for transportation to and from the lab. And then if an employee, again, going back to refusal to test, please, I highly do not recommend that you force employees into a vehicle and dragging them down to the lab. Because just to prevent you folks injury to the employee or anybody else, but you may be in a position to have to consult with Hawaii Police Department, particularly if you feel that the employee may be impaired and reported to work. So once you know, so you cannot unknow or unhear, unsee what you saw. So you may need to document that you've consulted, reasonable suspicion test was recommended, the employee refused, and just make sure to document. Now, you are not liable if you decide to initiate a reasonable suspicion test and the result is negative. Why? As long as you use the checklist and you mark off and sign, hopefully with another manager that they also witnessed some things, you are covered because the request for testing was based on what you saw and experienced at that point in time. But we have had that happen often. Lately, sadly, it's been more reasonable suspicion testing lately. And our managers and supervisors, particularly those who are trained like you guys, are right. When they request reasonable suspicion testing, it's been coming back positive. So, as long as you know what you're looking for and you have the tools to act, again, you're protecting the public, you're also protecting the company from risk and liability. So please bear that in mind. Any questions about reasonable suspicion testing? Okay. So number 12 on your quiz, a reasonable suspicion test should be conducted if you are informed by reliable sources that an employee is an alcoholic. No, that is not on the checklist. Please be very careful about second or third-hand information. We have even had family members of employees call the supervisor or administrator and say, my wife, my husband is a meth addict or an alcoholic. You cannot do a reasonable suspicion test based on that. You can only do it. It might be reason for you to monitor this person more closely. You can only do reasonable suspicion testing at that point in time. So if you see the behavior and you and another manager go, oh, shoot, we're not sure. Let's think about it some more. So you sleep on it overnight. You cannot come back to work the next morning and then do a reasonable suspicion test if the same signs and symptoms are no longer there. So there is a window of opportunity to do this. And so you do have to act quickly if it's reasonable suspicion testing. Yeah. We've had people call employers call and say, you know, this is what we saw on Tuesday and this is Friday. And so can we do a reasonable suspicion test? And my answer is no, you cannot do that. You might be able to do another type of testing, but please don't call it reasonable suspicion testing because employees can challenge that. Questions? Okay. So if there's a positive test or self-disclosure that comes to you, especially if the employee has a CDL, you want to make sure that they are removed immediately from safety sensitive duties, that they definitely work with HR to make sure that the referral form is generated. I've given you both the referral form for DOT employees as well as non-DOT employees. Both DOT and non-DOT employees are eligible for service from WorkLife Hawaii. So please complete the form, work with HR, send it over to us, and then you know, direct them to call us for their evaluation. We will determine through the evaluation the level of care that they need. And again, like I said, if they're DOT, then you'll have to call us anyway to get the name of the SAP that we're gonna assign. Meet with the employee to explain the process and register in the clearinghouse. Let them know that WorkLife Hawaii will conduct the assessment, refer, and monitor them till completion. We'll provide counseling for them in between as well as needed. The company, Suisan's going to have to schedule the return to duty test when they have completed all of our recommendations, and then implement the follow-up testing schedule when the employees return to duty. Please bear in mind that employees with drug and alcohol issues, when you're meeting with them, they may be impaired. So you don't want to have long, drawn out conversations. You may want to give information in writing so that they remember and they have an easier time following through. They will very likely be afraid and nervous of their job being at risk. They may be angry, they may be defensive, they may deny that they have a problem, they may be confused, have difficult time following your instructions. They may not understand what you're saying. Manipulation and triangulation sometimes happens between WorkLife Hawaii and the employer. So Renee and I communicate on these cases very closely to make sure, you know, Renee can call and say, hey, the employee tried to call you guys and 4 times and said that nobody's called them back. Well, WorkLife Hawaii is a 24/7 program. So if they in fact called, we would call them back, and they would be able to connect with someone or leave a message and have someone call them back. So very important that our communication stays wide open when we have these cases. And remember again that drug and alcohol information is highly, highly, highly protected. So we have to be very discreet. The resources that WorkLife Hawaii will refer your employees to may be a combo of these things, ranging from support groups to actual detox. There is a question. Number 14. substance withdrawal is extremely uncomfortable, but never life-threatening? And the answer is false. There are two substances that you as managers and supervisors should never ask an employee to quit cold turkey. One would be alcohol, and the other one would be on the chart that I gave you of all the substances. It would be under tranquilizers and benzodiazepine. If somebody tells you that they're using Valium daily, or they're drinking, unless you know how much they're drinking, and more details, it's never good. We've actually had to send someone to alcohol treatment in California and advised him to have a couple of drinks on the plane to avoid withdrawal. Because if they go through withdrawal symptoms in flight, that's going to constitute a medical emergency. So, alcohol, benzodiazepine, two substances that can be life-threatening. So individuals with those two types of addictions need to be weaned. So any questions, comments about that? Okay, so I'm gonna go through this real quick, and I want you to chime in your thoughts, your ideas. You are Lonnie's supervisor. You inform Lonnie that she has been selected for random testing today and provide instructions as to the location of the lab, time frame she must report, etc. But Lonnie interrupts you and explains that her doctor has prescribed a prescription painkiller for the extraction she had at the dentist yesterday. What do you do?
Where's the doctor's note?
Okay, you can ask her for a doctor's note.
To
What about-
confirm that.
That's true, that's true. What about the test?
Still send her.
Absolutely. Lonnie still needs to go. So it doesn't, at that point, once the employee is selected for testing, they cannot voluntarily tell you, oh, boss, I'm going to self-disclose that I have a problem. No, that's not considered a self-disclosure. Once you're selected for testing, you must go according to your company policy and DOT. So I would loop Renee in right away. I would have Lonnie, yes, Lonnie, you still have to go test.
Yeah.
And then you have to figure out whether Lonnie is able to perform her job safely and effectively while using the painkiller. So, yeah, it doesn't. Stan, I can hear somebody's background noise. So if you're not on mute, you might want to mute yourself. Thank you. Stan admits to you he drank too much the night before and is hungover, but he's one of your best drivers. Despite the hangover, Stan tells you he's confident he can work his scheduled shift. What do you do?
You don't drive.
And he's telling you, no, I got this. How long have you known me? You know, have you ever known me to be unsafe? You're going to hear all of the comments.
Consultator.
Send them home
Sorry.
for the day.
Yeah, you got to loop people in. As soon as you're made aware, make sure your company's looped in. Consider whether or not you have to do a reasonable suspicion test, because there could still be alcohol in their system. You don't know when their last drink was. It might have been 5 in the morning and their shift starts at 7. So look for what you're gonna do with Stan physically. Is he okay to drive? What are you gonna do? Does somebody have to pick up Stan? Does somebody have to drop him off? that all becomes issues you have to consider on behalf of Suisan. And consider a referral. Even if you decide to do the reasonable suspicion test, talk about a referral with HR and, you know, talk about, is this the first hangover? Or nah, he does this all the time. Remember that we're here not only for drug and alcohol issues. Employees are going through a lot of hard times right now, a lot of challenges for all of us, actually. It doesn't, not only employees, but especially with COVID. Please remind your employees that our services are confidential, free, voluntary. With our substance abuse services, for your CDL people, we will ask them to sign a statement of understanding. And that DOT says, that means we can share information with you openly. We can talk to the MRO without further consents. For your non-DOT employees, if it's substance related, we will always ask them to sign a release of information. They do have the ability legally to decline to sign. So if they decline to sign and we cannot disclose to you that, hey, we just saw a Suisan employee who has a pretty significant meth addiction, if they don't sign the release. We try really hard to explain to them that, you know, if you don't get the support of Suisan and the problems continue, your meth use continues, it's very likely that it's going to impact your performance and it's going to result in separation anyway. So we try really hard to get them to sign the release. 99.5% of the time, we're successful and we'll loop you guys in. But there is that small percentage that will not. These are our providers on Hawaii Island. We have quite a few. We do have Noelani Rodriguez. She is in Waimea, but she is a DOT SAP. And I have been known to fly to do evaluations on the Big Island as well when the need is great. So, you know, please know that we have on island providers as well. And remember that this is what our goal is, that we care about your employees, not only when they punch in, but, you know, we want them to have good quality of life outside of their jobs at Suisan, you know, and be successful in their other roles as parent, spouse, caregiver, all of those roles as well. So I do have an evaluation that was part of the handouts. I encourage you to please fill it out. Give me feedback, what you liked, what you didn't like, what you would like to see in future trainings. The last time we did this training was about 4 or 5 years ago. So for those of you who were there then, thank you. And I always try to update the presentation every time we do it. There's always something new anyway in this area. But want to mahalo all of you for hanging in there for 2 hours. If you have questions after this that come to you later or you just weren't comfortable asking, please feel free to give a call and call us directly. You can ask for me and I'm happy to answer any questions you might have. Any questions?
No, thank you so much, Naomi. Always a pleasure to talk to you. I really appreciate the training I know I found a lot of value in it, and I'm sure that our team has as well. And as you mentioned, it has been a while since we've had this training, so I think this is wonderful refresher for those of us who haven't had it in a while, and also a new experience for those who maybe never had the training. So yeah, really appreciate the time. And as Naomi said, if you have any questions for her, please feel free to reach out to her. I will provide Naomi's contact information to this group. Also, you can email her your training evaluations directly. Is that okay with you, Naomi?
Absolutely. Do you have my email? Should I drop it in the chat?
You can drop it in the chat. I'll also
Okay.
follow up with my email to the manager group so that they have it in their inbox. So again, please do fill out the training evaluation forms. Email that directly back to Naomi. No need to email it to me. You can email it directly to Naomi and she can get the feedback from you. This was a recorded training session. So if any of you have staff that was not able to attend, please send me their names, because we will be getting the recording put together and a link provided shortly. It is a mandatory training for all managers and supervisors. So if you have someone missing in your area, please let me know who they are so we can get the link sent to them. Any further comments or questions?
I've dropped my email and direct number in the chat. Hopefully you guys can see it, but please feel free to give a call. We have been doing consultations. Some of you have called for consultation, which is wonderful. And it can be as simple as, hey, this has happened. What do other people do? What should I do? This is what I've done. This is what's worked. This is, you know, what hasn't been working so well. You guys are able to access unlimited consultations via telephone. So please feel free.
Great. All right. Well, thank you, everyone. Hope everybody has a productive day. Thank you for joining us this morning. Have a good day. Bye-bye.
Happy holidays.
Thank you.
You're welcome.